Hello, my name is Alam. I am a student nurse practitioner at Franklin University. Today I would like to discuss type 2 diabetes. I want to present a scenario. Let's say I have a friend, best friend who I'm meeting for lunch and says, they're seemingly upset and say that they did a genetic home testing kit and, this report says I'm predisposed to type 2 diabetes. I don't know what should I do. I don't even eat sugary foods. Well, that's a lot to unpack, and I think we can sort of tackle it one part of it at a time. So diabetes, yes, diabetes is a disease that that shouldn't be taken lightly. It can be a silent killer, and it's something that it's something that you want to try to prevent as much as possible. Now, when it comes to predisposition to diabetes, that has to do with genetics. That means that if there's a family history of diabetes, yes, you'll be predisposed to it. That has that hereditary component, and genetics are something you can't really change. However, being predisposed to diabetes alone doesn't cause the disease. It would also have to be environmental factors that trigger it. So when we talk about environmental factors, you think about diet, you think about lifestyle, and you think about activity level. So with diet, of course, there are good carbs and there's bad carbs. So pretty much a lot of foods have carbs. It would just be like the protein, the meat group that doesn't have carbs. And of course, if you fry something, you bread it and fry it or marinades or whatever, of course that could add carbs to it. But usually if it's just the meat alone, it wouldn't have carbs. Now, fruits have carbs, vegetables, dairy, and grains. However, there is a difference between low nutritional value foods and high nutritional value foods. So fruits, vegetables are really good. They are healthy. Also grains, things that are not bleached. Dairy products that are skim, and limiting cheese, of course. Those are all good carbs that will help you to keep healthy, and you want to always pick these nutrient rich foods. Things like soda, pastries, chips, and cookies and pastry, all the unhealthy stuff should be limited. Also alcohol, you want to limit alcohol because alcohol it breaks down into sugar. And of course, smoking. I cannot stress that enough. Smoking is bad for all diseases. So if a person is a smoker and they're predisposed to diabetes, they definitely want to stop smoking. Besides that activity level, you don't want to lead a sedentary lifestyle. So yes, you want to be moving and grooving, exercising, doing whatever you can, making sure that you are physically active. That's another thing that will help prevent diabetes. And of course, stressors, lifestyle. You want to try to limit stressors. Stressors are bad for pretty much all diseases. It does release like inflammatory response in the body, and that's not good long term. And so yes, you want to try to be cognizant of the fact of any stressors that you have in life and try to reduce that. Well, that's kind of my quick spiel on type 2 diabetes. I hope you enjoyed this video and it was educational. Okay, thank you. Bye.